MUHC's Got Talent is quickly approaching, and we are so excited about it. On November 16th, we will take over the Corona Theatre for an incredible evening of music, singing, and fun. There are 11 teams who are performing and fundraising for causes close to their hearts, from cancer to cardiology to rare and genetic diseases. Our goal is to support research and patient care, all while showcasing the talents of our healthcare professionals. We are so fortunate to be able to share that we have an extremely talented host for MUHC's Got Talent. Florence K is an accomplished singer and musician and is joining us to MC the event, which is really exciting, and she joins us now. Hello, Florence.
Hi, how are you?
I am well, so happy to speak to you today and so happy that you're joining us for this event.
Well, I'm the excited one. I'm really, really thrilled about joining the event and hosting it. I cannot wait to see the numbers and the performers.
I agree. Now, let's get people to know a little bit more about you. So tell us a little bit about yourself. When did you find your love of music?
Oh, I guess I was about 3 years old or 4 years old. I grew up in a musical family. My parents were professional musicians, opera singer and guitarist, and so it was kind of really part of the environment. It's almost like I have no choice but to love it because that's what my house was all about. But the good news is that music is not a difficult thing to love. So I grew up with that, taking piano lessons, playing piano, starting to sing as a teenager, and then I became a pianist in a Polish restaurant in the old Montreal Stash Cafe for 4 years while I was studying, and then I went on to do a professional career, recorded about 10 albums, did as many tours, and then I fell in love with psychology. And so I went in a psychology program, and now I'm doing my PhD in clinical and research psychology with a clinical approach in neuropsychology. So I'm all about health too. And that's why I'm even more excited, because music and healthcare are a fantastic marriage.
Yeah, you sound like the absolute perfect person. Now, I know you sing in multiple languages. Is that difficult to switch between languages, or does each one carry its own beauty as far as music is concerned?
I like to think of the language as an instrument in itself, because it changes the sonority of a song. It changes the way the voice sounds as well, because of the intonation, because of how the words are pronounced. And to me, it's an added piece to the arrangement in itself. I personally don't find it difficult to switch from a language to another, because I see it as music, because I see it as a part of music. I also love learning languages. I don't have time to do it anymore right now. Maybe that's my retirement project in a few decades, but
which is a long while away.
Hopefully. But when I was a teen, I actually wanted to become a United Nations translator. I was fascinated by those people who just simultaneously translate these very important discussions from a language to another. And so I studied German, Spanish, Portuguese, Italian, and some I don't remember much about. But Spanish and Italian stuck with me, and Portuguese a little bit as well because of my love for bossa nova. So yeah, I find that we are lucky to live in a bilingual city, and it's a great opportunity to be able to work in both languages. I don't see it as a problem. I think it's fun also to make music in both languages.
Definitely. Our guest is Quebec musician and singer Florence K, and we're talking about her hosting the MUHC's Got Talent on November 16th. You can come in person. You can watch it virtually. Just head to muhcfoundation.com for details. So, Florence, you are the host, the first MUHC's Got Talent. Were you surprised to hear how many healthcare professionals have musical talents that they are willing to get up on stage and showcase?
Well, it kind of confirmed a myth, a legend that I always heard in my life, that doctors can be particularly good musicians and vice versa, that these two disciplines really complement each other well. It's something in the brain. It's something about creativity. I mean, I think that becoming a doctor, you have to be creative. You have to have a lot of divergent ideas. When you see a problem, you have to have a multiple different possibilities of approaches. You can't just think one problem equals one solution. So creativity is involved, and you have to be spontaneous about how you're gonna solve the problem, because obviously, if you don't solve the problem very quickly, it can cause really bad consequences. So I have a bunch of friends who work in the health and music as well. I have a friend who's in Toronto, ER doctor, who's also at the head of St. Michael's. Tim Rutledge, he is an amazing jazz saxophonist, and I mean, professional amazing. So it's just, I'm fascinated by the phenomenon.
Nice. And what does it mean to you to know that these doctors are fundraising for their departments, for causes that are close to their hearts?
It's community. It's social cohesion. It's community. It's showing that you care about the place you work at, which is really good. I mean, when you have a job somewhere, it's always a plus if you like where you work, and if you feel involved and committed to making it an even better place for the people who benefit from it. It also is good for the cohesion between the workers. It's good to know your colleagues in other settings than just the work environment, and this is the perfect setting to show your vulnerabilities as well. And this is how you get to know someone fully, and it creates a lot of laughs and fun laughs, not mean laughs. It creates a lot of inside stories, and then they can go on and carry on with these stories forever. And in 20 years, they'll be, I guess, I don't know, doing a C-section and be like, hey, remember when I was saying this? And
That's lovely. Now, you will be singing, which is very, very exciting. You'll be singing 2 songs while our 3 judges deliberate and decide on their top 3 favorite performers. Have you decided what you'll be singing yet? Are you giving us a little tease of what we can expect?
Actually, I don't know what I will sing, because I will figure out what's going to happen that evening, and then I'll just pick the songs I'm going to sing afterwards. I'm going to see I like to do that. I like to change my programs before. I like to be spontaneous about it. So I'll feel the audience, amazing. I'll feel the other artists, and then I'll pick my songs.
I love that. Now, your grandmother, Florence, is currently being cared for at the Montreal General Hospital. What message do you have for the healthcare professionals who are caring for her? Because I know it means a lot to you.
Yeah, so she's been there for 8 weeks already, and we didn't think she was going to survive what she was going through. She's 92 years old, and we were, ready to say goodbye, but the amazing care that was provided, we thought she would never walk again, and the physiotherapist that took care of her managed to help her walk again and smile, laugh, and the nurses, the préposés aux bénéficiaires, the doctors. We're talking about a miracle here. We were really, we thought we were saying goodbye, and here she is FaceTiming me and telling me fun stories about her day.
So she could watch virtually. She could watch you host MUHC's Got Talent virtually. We'll make sure that she has the link so she can cheer on her granddaughter.
Cool. And she's happy. And she has she says she loves her view on the city and the river.
That's amazing. Quebec singer and musician Florence K, thank you so much for joining us on Health Matters. We are absolutely thrilled that you're hosting MUHC's Got Talent, and we can't wait for the big night.
The pleasure is all mine, and I can't wait for the big night.
So once again, if you'd like to come, you can see and hear Florence sing. You can see 11 healthcare professionals or their bands singing. It is on November 16th at the Corona Theater. Just head to muhcfoundation.com. All the details are there.